My rule of thumb is always, number one, be factual. And again, let me re-emphasize that in this situation, there's still so many unknowns. The second is be truthful. If you don't know the answer or if you don't know the facts of the matter, we inform the public.
Okay, what's the difference between being factual and being truthful?
Well, I think the difference is you can be factual, but then you can also hide the facts that you don't know. That's where being truthful comes in. You have to be transparent. You let people know.
Okay.
Unfortunately, the science is still evolving, but as far as we know, this is the best course of action. And the last is be helpful. I think that's where maybe a lot of the gaps happen. You tell people that there are X number of cases, that the transmissibility is Y, and that these are the symptoms. And then you stop short of that.
Okay, how would you evaluate the government in terms of those measures?
Well, let me try to be diplomatic. On the one hand, I feel...
No, don't be. Be factual, be truthful.
First of all, I feel the government is trying its best. Okay, so that's my first answer. The second, my honest assessment is there is a lot, referring back to what I mentioned earlier, a lot of the communication is focusing on the hazard, how dangerous it is, who is at risk, etc., but not enough on the outrage. There's not enough communication out there telling people that, first, like what Doc Tony mentioned earlier, yes, we have 35 cases, but there are hundreds more who tested negative. There are media reports now in China that are emphasizing how many people have recovered. And that gives people a sense of hope. And then it kind of puts everything into perspective.
It also doesn't seem...
When you communicate about risk, generally there are two dimensions you consider. The first is the hazard itself. How dangerous is it? Will it really kill you, frankly? Or will it just cause a mild illness? The other is the outrage. So people are either apathetic or at the opposite extreme, they're very angry and they're unreasonable. The difficulty with communicating in COVID is there is a third dimension, which is the novelty. On the one hand, this is the first time that the general public is hearing about this. It isn't like tuberculosis or diabetes or hypertension. So that generates naturally a lot of reactions. But it cuts both ways. Even for the scientific community, there's still so much that we are discovering, continuing to discover. So that's part of the challenge.
And we don't want to swing either way. You don't want to be alarmist, at the same time you don't want to be too apathetic. You know? But that is one of the criticisms of government now and of DOH, because people are saying this is not just a crisis with the disease, it is a crisis with communication as well. The press con last week was the DOH saying, sabi nga ng WHO, model country raw tayo eh. I mean, what should be the message at this point? Should it swing towards, no, hindi, matakot na tayo, let's be honest, matakot na tayo, or should the message still accommodate, for example, the Department of Tourism that says, no, let's go on with our lives and wag natin hahayaan bumagsak ang ekonomiya. By all means, ituloy natin ang mga plano natin.
Right. I think to answer that, we have to first unpack what makes people panic in the first place. And generally, people panic because of three things. There is something unknown. There is something that's unpredictable. You don't know if it's going to come today or tomorrow. Or there's something that you know what it is, you know when it will come, but you can't understand. So that should cue you in on the messaging. What is known, unknown, what is predictable, and how can we explain that in such a way that people will understand and make it actionable.
Okay, if you were in the press conference and people were listening, what exactly would you say in terms of the potential danger that this could cause the public in general? And what preparations, what should they do?
Right. Yeah. So I would go to the classic public health messaging on the one hand, as Robbie has emphasized. Wash your hands, keep them clean, stop touching your face, and avoid going into mass events as much as you can. But at the same time, I will also go into telling people what they can do within their spheres of influence. What do I mean? prepare your families. Talk to your manager, talk to your boss. Understand what is the policy in your workplace. Mobilize your communities if you need to. These are things that people can actually do and make them feel that they're part of the response. And frankly, we should all be part of the response.
But let me